Have you ever gone to the doctor thinking, no, knowing that you know what's going on, only to be surprised to learn that it's something else entirely? That's a very common story when it comes to a stress fracture. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Stress fractures always seem to surprise my patients. In today's video, we'll discuss why it's important to identify stress fractures early so they can be treated properly. Before I do, please like, comment, share on social media, and hit the subscribe button so you don't miss a new video. Also, I wrote a book all about broken feet and foot fractures. You can get it for free at www.footfracturebook.com. A stress fracture is a non-displaced break in a bone. It's due to excessive pressure on that bone. The persistent pressure causes the bone to fatigue and weaken, and this leads to the bone breaking. Stress fractures are common in the foot in the metatarsal bones, the tarsal bones that make up the middle of the foot, and the heel bone. Now you'd think that you would know that your foot is broken. With a stress fracture, there usually isn't a memorable event that led to the bone breaking. For instance, if you twist your foot or jump off a ladder, you'll understand how that could lead to a fracture of your foot. But that's not the case for a stress fracture. A stress fracture may occur if you're training for a marathon or during a long hike, anything that involves persistent and repetitive pressure on the bone. You may start feeling pain when you're bearing weight. This can lead to swelling and bruising. That's usually what brings you into the office. I'll take an x-ray, and I'm going to break the news to you that you're suffering from a stress fracture. A common reaction that I get after sharing that news is being asked, well, it's a fracture, but the bone isn't broken, right? Call it what you want. A fracture is a broken bone. It may just appear as a crack in the bone or a hairline fracture, but it is essential to treat it as you would any other broken bone. This includes immobilizing the foot to ensure the fracture doesn't worsen and become displaced. Depending on where the fracture is, you may need to use crutches or a knee scooter to keep the pressure off of your foot. Of course, you'll need to stop training or hiking or running, anything that causes stress to the fractured bone. For how long? Well, it takes 6 to 8 weeks for the fracture to clinically heal. That's just how long it takes for bone to heal. No negotiation will change that. You'll typically be able to return to activity and exercise after about 12 weeks. What if you don't wait? What if you keep running? If that's the case, you run the risk of causing the fracture to worsen and become displaced. This may require surgery to fix the break. That will extend your recovery time. If a displaced fracture is not addressed, it can heal improperly, which can lead to arthritic changes. And then you'll have ongoing pain and problems, and no one wants that to happen. In next week's video, we're going to discuss traumatic metatarsal fractures, including the dreaded Jones fracture. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit the subscribe button so you won't miss another video. And don't forget to order my book all about foot fractures and broken feet. You can get it for free at www.footfracturebook.com. The link is in the description. If you're concerned that the pain you're feeling is a stress fracture, give the office a call for an immediate appointment. All we need is an x-ray to see what is happening. That link is also in the description. Thanks so much for watching, and have a great day.